do either of you feel that the best strategy is to work with our Department of Health slash state? And I would even expand that and ask if you could speak to, ways you think we can engage, health centers can engage with the state in general and what to expect from state responses.
Yeah, so I would say, certainly having that connection that with your primary care association is going to be important to have a kind of group response or group strategy as to what the dynamic is with your public health department or state Medicaid agency, because that's going to be so critical to present that unified message and strategy for those state agency officials.
And I can just speak to piggyback on that. The I never say that there's any one strategy that one should do over any others. I think there are always going to be a mixture of strategies that we should be thinking about to support this work because it is so varied and interdependent. But at the end of the day, um, the state is always going to be the one that will then dictate how Medicaid is provisioned within that particular state. They're the ones that are going to be setting the requirements for the health plans, and based on HR one, they're also the ones that could stand to be the most impacted from a funding standpoint associated with it. In our work in the markets that we're operating we have very meaningful relationships with both departments of health and state Medicaid agencies in both states, and actually working in tandem with them to help set the requirements for the health plans around how value-based care can actually be deployed for our FQHC partners. And we found them to be really open and engaging partners in this work. So I definitely encourage anyone to continue to leverage the state in that way.